Hello viewers, welcome to this episode. This time round I'm going to talk about testicular torsion, which is a surgical emergency. What testicular torsion means is that the testis twists upon itself, and when that happens, the blood supply to the testis becomes impaired, so it leads to dying off of the testicular tissue. This disease is common mostly in teenagers and also in children less than a month old, and there's no really specific cause. We just have things called risk factors that predispose somebody or put somebody at risk of having testicular torsion. Some of these risk factors are some congenital abnormalities. Somebody is born with some abnormalities like a syndrome we call Bell-Clapper syndrome, and also other things that can predispose somebody to testicular torsion is if somebody gets trauma of any kind, and many other causes. How it presents: somebody will have pain in the scrotum, either the right side or the left side or both, and they'll have swelling, and the pain is normally very severe. As I'd said earlier, it's an emergency, so if somebody has pain in that region, it has to be addressed very quickly. They have to go to hospital. We have about only 6 hours to save the viability of the testis. And what happens when somebody comes to hospital on time? We are going to identify the problem. We can do an ultrasound and see that the blood vessels are fine or not. Then we make a decision to take the patient to the operating room to either remove the testis if unfortunately it has died off, and also we do a procedure that will help to reduce recurrence of the problem. And I think this is very important, and let's spread the word so that we will have reduced of such cases, and if it happens, we will be able to come to hospital in good time. So since we have the information now, I think we should spread this information widely so that we will be able to address the issue even better. If somebody has the pain and the diagnosis is made, they can be able to get appropriate treatment. If we are able to save the testis, then that will be very good. And if that is not possible, you can be able to do the procedure that we do to reduce recurrence and save fertility for the many clients who get this condition.